We are back. We are back talking about hair loss, and we have Kayla with us, and we were talking throughout the break about just different terms that are used. They're very difficult terms, so we're not going to talk all about that. But one word came to mind was brought up, and that's called alopecia. And I think a lot of people have heard of that. And just what is alopecia? I mean, what do you consider alopecia?
Yeah. So I think when most people think of alopecia, they think of, a disorder or a disease, whereas the term alopecia technically just means hair loss of hair.
Okay.
And so any type of hair loss can be considered alopecia. For the most part, we do consider like the female pattern baldness, like that can be called female pattern alopecia. And so that's the term I think most people will use with it. But technically, if you're wearing your ponytail too tight and you're losing a bunch of hair, or you have medications that are causing it, it's considered alopecia. So it's really just a term for hair loss.
Could it be also like a deficiency in certain,
Absolutely. Like it
nutrients
can be in nutrients, in hormones, and so sometimes one of the treatments could be just increasing multivitamins or increasing your biotin intake can help get that hair back. And really, when we think about it, biotin it's one of those I shouldn't say a multivitamin out there that people tend to associate with how do I get my hair to come back? Hey, healthy hair and nails is biotin, and that is something we might just suggest. Just if you're losing more hair and it's due to stress or a vitamin deficiency, let's try that first. Other things could be if your estrogen levels are too low. We talk about either adding estrogen. Sometimes it could be a lack of estrogen that's causing it, so maybe we need to add a little bit more. But that depends on your stage of life too. But that is something to bring up with your provider of, could this be causing my deficiency, and what can we do to fix it?
And we've talked about menopause this week, and menopause you mentioned almost right away is kind of a time where you might have some issues with hair loss.
Yeah, because like you've talked about, in menopause your estrogen and progesterone levels drop. Well, your male hormones, we all have female and male hormones, your male hormones don't drop. And so you may discover hair in different places. You might be growing hair that you didn't have before, along with losing the hair that you want to have. And so some of that might be, do we need to do a little hormonal treatment, or is this just something we're gonna have to live with? Or like I said, some of those medications are being tested and studied right now to help kind of hopefully grow some of that hair back.
So can you expand on that? There are some other options, because you'd mentioned Rogaine for women, multivitamin. What are some of the other options?
There's some laser therapies that you can use for women. Other things like increasing your vitamins, for sure, definitely. Those are kind of the biggest ones. Like I said, it might be increasing hormones. A change in your hormones might help too.
And so that's why you need to have the discussion. When you said, some people might be like, this is just, I'm just going to live with this. But there are a lot of people who are like, no, I don't want to. I want to try some of the options that are out there.
And there might be a lot of people that think this is just something that happens. There's nothing we can do about it. It also could be something as simple as your thyroid. Having your thyroid checked sometimes can cause, a thyroid deficiency can cause hair loss too. So there could be things that we really do seriously need to look into if you're noticing a big change in your hair. But I think as women, we lose our hair. We know when we're styling it, we lose hair, and so sometimes we think it just happens. It's just something I have to live with, but it's not always.
The thyroid is so tricky.
Isn't it?
It affects so many.
Hear about that all the time, and so many people are affected with the thyroid.
There is.
So it's a true thing right there.
It is.
So, okay. So also, people, like excessive dieting.
Yeah. Yep. Excessive weight loss or crash, restrictive diets, because again, you're usually deficient in some of your vitamins and minerals, and that's what's going to cause that hair loss. But any, significant stressor, which rapid weight loss is still a stressor on your body, a significant stressor on your body. So rapid weight loss, restrictive diets, which we see pop up all the time, can cause some of your hair to fall out.
Okay.
And you mentioned, some of the vitamins and different things for your hair and nails. Can your nails also be, a sign of something not being quite right?
Sure. If your you can always pay attention if they're starting to become more brittle or breaking, things like that definitely could be a sign of deficiencies. Obviously different if you're having them done every week and they're being filed off. But if you have natural nails and they're getting any major changes that you're noticing in your body, that's really the most important thing. Pay attention to kind of what's going on. And don't just assume it's normal all the time. It can be, but it might not be.
Yeah.
So often, especially with women, that's why we're having these conversations
Right.
this
Yes.
week. We think, well, it's just, something we have to deal with, or we just brush it off because we have other people to take care of.
Or we have a lot in our minds and we forget. So I do usually recommend to
true,
my
too.
patients, like, make a list, put it in that note
good
option in
point.
your phone is great. I love when my patients whip out their phones and go to their notes, because then I know you've been thinking about it.
Yeah, that's a
and
very
we won't forget
good-
anything.
Good tip. I like that tip too. Otherwise, can you go, like, could your hairdresser give you something? I mean, I don't know. Maybe you aren't. You're not a hairdresser, obviously, but is that something too that
I would
they
say
can give us
their
something?
biggest tip might be to watch what you're doing with your hair.
Yeah.
I know I personally experienced that one time too. I was like, my hair just seems to be falling out. She goes, you wear it in a ponytail every day. Oh, yeah, I do.
Okay.
You're right. So definitely it's something to talk with them about, though, because you're right. Especially if you see the same person all the time, right? They know what you're doing to your hair. So for sure, bring it up to them too.
Maybe they're doing too much to your hair.
Maybe.
It's not just us. We're the ones saying,
Well,
color
right.
it, dye it, do
Yeah,
all
we're
that stuff.
coloring it and
Yeah.
doing different things as far as your hair goes. I think you play around with your hair a lot and whatnot, but there's definitely a time when you should be concerned. And
Absolutely.
So, good point.
Thank
That's
you so
when
much.
we need to go in.
Yeah, thank you so much
Absolutely.
for joining us today and kind of walking us through everything that could possibly
Yes.
be happening.
Yes.
Absolutely.
Stay with us. Coming up next here on North Dakota Today, we're going to be checking in with our VNL Deal of the Week.